Suture materials. Now part 2 we are looking at the non-absorbable. In case of the non-absorbable, first we are looking at the silk. The silk is nothing but it can be braided or it can be twisted, and it is multifilament. And next, it can also be coated. It is coated and it has wax as well as it can have silicone, or it can be the under. Now looking at the uses of the silk is nothing but it is a ligation as well as the suturing, and when long-term use support, it's basically used in terms of long-term support. And for example, the silk, it can be used in terms of the securing the drains as well as the 2-layer bowel anastomosis. So in such cases the silk is used. Next we are looking at the surgical steel. Surgical steel is also unabsorbable. So surgical steel, it is used in case it can be the monofilament as well it can be the multifilament. So this surgical steel, it is used in case of the closure of the sternotomy wounds. Next we are looking at the nylon. Now what is this nylon? The nylon, it can again be the monofilament as well it can be braided multifilament. And looking at the uses of the nylon, it is used in case of the skin closure as well as the abdominal wall closure, can be used in case of the hernia repair, and also in case of the neurosurgery. So N and N, N for nylon, N for neurosurgery. Next, moving on to the polybuster. In case of the polybuster, it can be the monofilament. And what is the use? It exhibits elasticity. Polybuster, it has major property of elasticity, and it is used in case of the plastic surgery. So the most favorable in case of plastic surgery would be the polybuster. Then looking at the polypropylene. Polypropylene is also commonly known as proline, and looking at the type, it is a monofilament. And this uses being, it is used in case of the cardiovascular surgery, the vascular anastomosis, as well as the plastic surgery. So earlier we had seen the plastic surgery was used, that is the polybuster was used, and here again the polypropylene is used in plastic surgery, and then also in case of the general surgical subcutaneous skin closure. So this is also where the polypropylene is used.